All right, hello. I will be doing my head to toe assessment. My name is Patricia. I have my volunteer here. His name is Cabral, and he. So I'm recording this video for educational purposes for Nightingale, my school. Do you consent to participating in the demonstration of the video being recorded?
Yes.
For grading purposes.
Yes, I consent.
All right, perfect. So I'm gonna go ahead and start. I'm gonna start by performing hand hygiene. First, I'm gonna knock on the patient's door and just introduce myself. Knock, knock, knock. My name is Patricia. I am the nursing student. I will be assessing you today after your tonsillectomy procedure. We just want to make sure everything's working well and that there was no problem with the procedure, if that's okay. Okay? So, privacy curtain closed, perform hand hygiene. Now I just have to put my gloves on. Like I said, my name is Patricia. I am the nursing student, and we're gonna start by doing a head-to-toe assessment. Can you verify your first name, last name, date of birth, and
Cabral Lebratu, June 23rd, 1989.
Okay, perfect. Do you know what today is?
Sunday.
Okay. Do you know where you are?
Yes, at home.
I'm sorry, what you said?
At home.
Okay, perfect. And then, do you know who the president is?
Donald Trump.
All right. And do you know why you're here?
For a checkup, for a head-to-toe assessment.
Yep, perfect. So alert and oriented ×4. The patient is appropriately groomed. There's no acute distress on the outside. Speech is clear. Go ahead and stand up right away. Okay, posture is upright and breathing is unlabored. Okay, go ahead and have a seat. Great. Now I'm going to get your vitals. Okay. So this is a pulse ox. It checks your temperature and, it checks your pulse and your oxygen saturation, blood pressure cuff for your blood pressure. Okay. All right, so I'm gonna go ahead and get your blood pressure and all that stuff, okay?
All right.
All right, so blood pressure was 112 over 73. So that is the good blood pressure that we have here. And now I'm going to check it. Let's see. Pulse is 65 and oxygen is 98. All right, so, and then I'm gonna check your temperature. All right, and temperature is 98.2. Okay, and then I'm just gonna check your pulse one more time. and respirations, I got 13. That is when your chest rises and falls. I didn't want to tell you because I didn't want you to affect the outcome or try to breathe different. Just want you to breathe regular. So pulse and respirations, temperature, and blood pressure and oxygen saturation is all within range. Once again, it was 98% on room air, which is great. Are you having any pain? And if you do have pain, please rate it on a scale from 0 to 10. 0 being the worst, 0 being no pain, 10 being the worst. Where it is located, and what does it feel like, and what happens to make it better or worse?
No pain currently.
No pain at all? Okay, so patient reports no pain, 0 out of 10, right? Yep, 0 out of 10. All right, so moving on to the next part of the assessment. So we just did the vitals and checked your pain. Now we're gonna focus on your head. I'm gonna touch your head if that's okay. So patient's head seems to be bald. There's no scars or lesions or nits in the hair because you're bald. I'm gonna have you go ahead and open your mouth and say ah. There's a pen light, but I'm just gonna look inside, okay? Say ah. All right, perfect. Lips are pink and moist. Gums are intact. Mouth mucosa and platelets are pink and moist as well. Tongue is midline. I did see that. The uvula rises symmetrically, and the tonsils are without redness or swelling or exudate. So that is a good assessment to have. Now I'm just gonna check your nostrils, okay? I'm just gonna put my pen light up there. Okay, that is also pink, and the nose is midline to his face, so it's symmetrical. Septum is intact. Nasal mucosa is pink and without drainage, so there's nothing in there. Please cover one nostril, and I'm gonna have you smell something. Okay, go ahead and cover one nostril. Smell. Can you please identify the smell?
Perfume.
Okay, cover the other nostril. Smell.
Perfume.
Okay, perfect. So both nares are patent. There's no blockage, and you correctly identified the scent. So that is great. Okay, next is to check the sinuses. So I'm just gonna check your sinuses here. Are you experiencing any pain?
No.
Okay, perfect. So frontal and maxillary sinuses are non-tender, so that is good. Next, I'm going to say a word. I'm going to whisper it to you. I need you to respond back what the word is. Go ahead and focus that way and just close your eyes. All right.
Banana.
Perfect.
Orange.
Yes, perfect. So that means that hearing is intact bilaterally. So now I'm going to perform the Weber test. I don't have that, but if I was to perform it, I would. Yeah, Weber test shows no lateralization. You're hearing out of both sides. Now I'm going to do the Rhine test. And so it starts here, ping, ping. Okay, Rhine test shows air conduction is greater than bone conduction bilaterally. So that means the external ear and ear canals are here as well. So now I'm just gonna check your ears. Okay. All right, so tympanic membrane is pearly gray and intact. Now I'm just gonna check your eyes. Just look forward, please. I'm not gonna put the pin light in your eyes. I'm just gonna look at them. The eyes are symmetrical, and the conjunctiva is pink, and the sclera is white. Okay, so now I'm gonna go ahead and shine that pin light in your eyes, okay? All right, I'm gonna start on the left-hand side, okay? It's really hard to see in here, but okay, there we go. Okay, so pupils are equal, round, and reactive to light, and accommodating. Now we're gonna do a visual acuity test, to see how well you can see. So I'm gonna have you stand up over here and stand right here. No, you stand right here. And I'm gonna point to the Snell chart, and you're going to read off each letter I point to, okay? All right, we're gonna start. Please cover your left eye.
F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T.
Perfect. Go ahead and cover the other eye the same. And we're gonna start from line 9, and we're gonna read from right to left. Go ahead.
T, C, P, D, O, F, E, L, C, E, T, O, P, F, E, D, D, Z, P, O, L, E, F, P, Z, C, F, D, E.
Perfect. Go ahead and have a seat. Thank you so much for that. So visual acuity is 20/20 using the Snell and eye chart. All right, so now I am going to feel your lymph nodes, okay? Right here. Okay, so they are non-tender and palpable, non-palpable. So there's no issues with that. So we're in great, we're in great hands. Forgot where I was. Okay, so the neck is symmetrical. The trachea is midline here. There's no JVD distension present. And then I'm going to now check the pulses. So I'm gonna go ahead and check your radial pulse. Okay, +2. And then I'm gonna go ahead and check your posterior tibialis. If we wanna, it's okay. Just gonna check the top of your foot here. All right, they are great, +2. No threading or bounding, so these are good. Okay. And then +2, and they're equal bilaterally. Okay, so all right, continuing on, I'm going to have you move your neck up and down, and then left and right, and then touch your shoulders to your ears. Perfect. So neck range of motion is full without any pain. Were you experiencing any pain doing that? Perfect. Okay, now I'm gonna have you shrug your shoulders like this against my hand. All right. Okay. Shoulder strength is equal and bilateral. So, all right. So now we're moving on to the respiratory part. Are you experiencing any shortness of breath, breathing, or coughing issues?
No.
All right. The patient denies shortness of breath and coughing. Okay. Respiratories so far, when I took them earlier today, they were 13. Regular. Doesn't look like there's any accessory muscle use, so your breathing is fine. The chest, we're gonna look at the chest. The chest is symmetrical and non-tender without any masses or crepitus. We would have you remove your shirt to really see this, but we don't have to do this for this video for the moment. Please, oh yeah, so now I am going to listen to your lungs, okay? So I'm gonna have you take deep breaths and just go ahead, okay?
Okay.
All right, so we're gonna be doing the front of the chest, if that makes sense. The interior part of the chest we're gonna be listening to. Go ahead and take a deep breath. Okay, so chest expansion is equal and symmetrical. Okay, so just please breathe deep and slowly through your mouth. Okay, go ahead. Okay. All right. So lung sounds are clear, equal bilateral in the anterior part. No wheezing or crackling or rhonchi are presented. So I'm gonna have you turn towards there, and I'm gonna listen. Oh, you gotta get up so I can listen to your back. Yep, on the side, please. Perfect. Okay. So same slow and deep breaths for me, please. I'm gonna go do the same pattern. All right. Okay, so lung sounds are clear in the posterior fields. No wheezing, crackling, or rhonchi presented. So we're good. Now we're moving on to the cardiovascular part of that. So we're going to be checking your pulses again. And then I am going to, listen to your heart. Okay, so start with the temporal tube. Okay, they are bilateral and 2+. Now I'm gonna palpate the carotid here. I'm gonna do them separately because we don't want you to pass out. Okay. All right, so they are bilateral and 2+. So they're normal. And then now I am going to auscultate the lungs. Okay? So there's 1, 2, 3, 4, 5 places I'm going to listen to on your chest, okay? So first we're gonna start with your aortic. And there's nothing you need to do. I can just. Okay, moving on to the pulmonic. Okay, down to Erb's point. Tricuspid. And then mitral. And here I'm gonna stop and count for a full 60 seconds to make sure that your pulses match up. Okay, all right, so I got 68, so pulse is great. It's 68. Heart rate and rhythm is regular. S1 and S2 are present without any murmur, rubs, or gallops. So now I'm gonna check your radial pulse again. Go ahead, yep, just like that. Okay, they are present, 2+, and bilateral. I would check your femoral, but we're on camera, so I'm just gonna move down to your the top of your foot, okay? Pulses are, okay, they're strong and heard in both quadrants here. So 2+ for the posterior tibialis. It's kind of hard to say, okay? And then the dorsal, this one's pretty hard. Dorsal pedialis, I have to check. Okay. All right. Okay, so there are 2+. A little difficult to get in there, but I did, so that's good. All right, now I'm gonna check your cap refills. Can I see your fingers? Okay. Okay, so cap refills is less than 2 seconds. So great. Now I'm gonna check your toes. All right, less than 2 seconds, which is good. Anything less than 3 seconds means the blood is flowing well. Okay. So yeah, fingers and toes. Now we're gonna do the stomach and the abdomen. I don't want you to lay down, so I maybe I'll have you lay down. Okay, for this purpose, I'll just have you lay down. Go ahead and lay down on the floor. Cindy, you might need help with the camera. Oh, you can see? Okay. All right. My knees. All right. Okay, so abdomen is symmetrical and non-distended, which is great. I'm not gonna make you lift your shirt up for this because, yeah. There's no surgery, scars. It seems clean and dry, intact without any redness or swelling, so, or bleeding or drainage. So that's good to know. And when's the last time you had a bowel movement?
This morning.
This morning, and what would you say that was like? Was it
Normal.
normal? It was normal, so it wasn't hard or
No.
or runny. Okay, perfect. So, and then when's the last time you urinated?
Maybe an hour ago.
Okay, all right. And then there was no odor, okay, or pain. Okay, perfect. So, all right. So now I'm gonna listen for your vowel sounds. Okay. Okay, we're gonna start and just kind of follow the color along here. Okay, so normal active vowel sounds heard in all four quadrants. Oh, wait. Blah, blah, blah. I messed up. I'm supposed to palpate. I'm sorry. But I'm gonna palpate. It's just tapping on your abdomen. All right, so, yes. I palpated. I will also take, no, I did it right. I listened, and then I palpated. Vowel sounds are present in all four quadrants. Now I'm going to do some deep and light touching in all four quadrants, and please let me know if you have any pain, okay?
Okay.
So this is the light percussion, and this is deep. Okay, how are you feeling? Any pain?
No.
Okay, all right. So the abdomen is soft, non-tender, without guarding, rigidity, rebound, tenderness, or palpable masses. So we're good. Are you experiencing any nausea, vomiting, constipation, diarrhea, or difficulty urinating?
No.
Perfect. And the patient denies bowel or bladder problems and reports that bowel movement was, you said this morning, earlier, and you used the restroom about an hour ago.
Yes.
Okay, perfect. All right, so I'm gonna go ahead and have you stand up. I can help you. Okay, perfect. And just have a seat back down in the chair. We're doing the musculoskeletal part next. Okay, so please raise both of your arms out. Okay, and then, oh yeah, bend your elbows. Perfect. Rotate your wrists. Yep. Okay, yep. And then I'm gonna have you with both hands. Okay. Squeeze my fingers. Yep. Go ahead, you can squeeze tight, I swear I'm strong. All right, so range of motion for his elbows are intact. Hand grips are strong and equal with strength bilateral 5 out of 5. Please raise each leg. Perfect. Raise each leg and then bend. Yep, just like that. And then the other one. Bend. Okay, perfect. All right. So can you lift your leg and move your ankles in a circle? Okay. the other way, perfect. And then, okay, I'm gonna hold down on your feet and just lift up your feet while keep the heel of your foot, but lift this, kind of like this.
Oh, yeah.
Okay, all right, go ahead. All right, perfect. And then go ahead and lift them up all the way. Okay, and now try to press down like you're on the gas pedal. All right, that's great. I'm gonna squish my hands. Lower extremity range of motion is intact. Strength 5 out of 5 bilaterally. Okay, so now I'm gonna have you stand up. All right, perfect. Can you bend forward?
Yes.
Okay, can you bend forward for me? Perfect. And then back up. All right, can you lean to the side? The other side. Okay, can you rotate your back? Yep. Okay, back range of motion is intact. Please close your eyes. And I am going to, what do I have? Oh, here we go. All right, tell me if this is dull or sharp, okay?
Dull.
Okay,
Dull.
okay.
Dull. Dull.
Okay. All right.
Sharp. 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 Sharp.
All right. Perfect. The patient correctly identified the sharp sensation and dull sensation in all extremities. So sensation is intact and symmetrical. Do you have any pain, stiffness, swelling in any of your joints?
No.
Perfect. The patient denies any joint pain or swelling or stiffness. Next is going to be a neuro exam, and this is where we test your brain function. Go ahead and have a seat. All right, so this is the neurological exam. I know this is long, but we're almost done, I promise. We only have a couple of more, and then we'll be finished.
Okay.
So please tell me your name.
Cabral Nabratu.
Where are you today?
At home.
And today's date.
July 19th, 2026.
Okay, the patient is alert and oriented to person, place, and time. Please stand all the way back there. And then I'm gonna have you walk several steps, turn, and then walk back. So,
Okay.
this up a minute. So walk towards me, and then turn that way, and then walk back. All right. Okay. The patient has a steady gait and it's coordinated. Please touch your finger to your nose. Okay. And then touch my hand.
With the same finger?
You got it. Switch it.
Okay.
So that finger goes to this. Nope.
Yeah.
This finger goes to this. Okay, other one? Okay, perfect. All right, so patient, please, okay. So that's good. Go ahead and have a seat. Sorry. I'm gonna have you slide your shin down all the way to your foot, okay? Do not lift it. It has to be right on the front. Nope, right on, this is here. Here. Can you do that, or is that too much? And then slide it all the way down. Okay? Other one? Starting from the knee, slide all the way down. Okay, perfect. Coordination is smooth and intact bilaterally. Okay, so now I'm gonna get into your reflexes. I don't have a hammer, but if I did, I would. It's supposed to make your arm quick. Just relax, relax on. Okay, biceps. Try biceps. Okay. I don't know how this would work. Biceps. Okay, the patella, your knee. Okay. I don't have the best. A hammer would be great, but I don't have one right now. But if I did, you would be able to feel that. Okay, and then move your your foot. Lift your foot up. Okay, and then just yep. Okay, and then so biceps, triceps, patella, Achilles reflex are 2+ and equally bilateral. The patient opens their eyes spontaneously, is oriented, and follows command. So the Glasgow score here would be 15. All right, so now I'm gonna do your skin, hair, and nails. So skin is warm and dry and intact. There doesn't seem to be any bed sores or anything like that. And it is appropriate for patient's complexion, so we don't see anything. Patient's not pale, flushed, cyanotic, clammy, or unusually hot or cold. Okay, so I'm gonna go ahead and do skin turgor here. Okay. All right, so skin turgor is elastic with immediate recoil, so that means you're not dehydrated. No abnormal rashes, abrasions, tenderness, lumps, or lesions are present. And then, okay. Bony prominence seems to be intact without redness or skin breakdown. And then go ahead and stand up. So bony prominence is back here. Yeah, so sorry. Intact, no skin breakdown, no redness or anything like that. Let me see here. The nails are clean and cut and dry. Without crackling or any pitting, edema or clubbing or anything like that. The hair on the head is none, but you do have facial hair and it seems to be intact. There are no nits, no abnormal things or missing patches, so that is good. All right, so now I'm all finished with these exam. You can scoot over. Yeah. Okay. I'm all finished with the exam. I'm removing my gloves. Ooh, sweaty. And I'm performing hand hygiene. All right. Thank you so much for bearing with me and completing my assessment. I do have some patient education for you that we should complete, and then after that I'll be out of your hair, I promise. So patient's overall condition is because you had a tonsillectomy, and this is to monitor post-operative complications. So any bleeding or obstructions, infections, pain, or any dehydration. But with my overall assessment, everything looked really good, but we want to continue that trajectory. So drink plenty of fluids, eat soft foods as tolerated, avoid spicy, acidic, or rough foods because they may irritate the surgical scar, okay? Take your pain meds exactly as the provider prescribed them to you. Ice is great. Also, it's used to help with the discomfort as well if you eat ice. Avoid coughing, clearing your throat, using straws. Don't use straws. And then any strenuous activity that could increase. Yeah, so like no working out. We're just gonna lay low for a little bit because we don't want to increase the bleeding. Some throat pain, ear pain, bad breath, while some throat pain, ear pain, and bad breath may occur while the throat is healing, and this is totally normal. Report any bright red blood from the mouth or nose, frequent swallowing, vomiting, blood, difficulty breathing, and signs of dehydration. So, fever, as decided by your healthcare provider, or bright red blood, that's an emergency. Okay?
Okay.
I'm gonna put the bed back into the lowest position here. I'm handing you your call light, and I'm just going to go prepare some additional testing. Some other assessments that I might do would be monitoring your airway or O2 sats or your swallowing, hydration status, of course, because you need to stay with fluid, pain levels, because you did just have a procedure, so it's normal to be in pain, and if you do, please let me know. Oral intake, anything you're eating or drinking, I would want to monitor it just so we don't have any occlusion issues with your breathing. And then signs of bleeding or infection of the site. So those are some other things I would look out. I would look out for as a nurse. But if you have any problems, here's your call light. Just give me a call. Do you have any questions?
Nope.
That was fairly easy, right?
Yes, thank you.
Okay, all right. So I'm opening the curtains, sanitizing my hands. All right, so I'm gonna go ahead and go document this assessment to the provider. And I will either see you later or you have a great day, okay?
Thank you. You too.
All right, thank you. Goodbye.